Hey, Diana.
Hey, how are you?
I'm good. How are you?
Good.
And also, hi, Lisa.
Hi, Lisa.
Hello.
Hi, Teresa.
Hi, how are you?
Good. How are you?
Good, thanks. It seems like it's been a while.
It does feel like it's been a little bit.
Yeah, happy to see you all. And looking forward to this excellent meeting. Thank you for these speakers.
I'm looking forward to this one too.
And I'm getting ready to email you the information about our food conference. We're a little bit late getting it out, but November 15th is our conference. So I will send that to you this afternoon or tomorrow morning, Annika.
Okay, that's so exciting. Thanks, Teresa.
And if it can go out to the group, that would be great.
Yes, I'll share it. Hi, Liz, and hi, Julie. I'm Annika.
Hello. Hi, nice to see you. Thanks for having us.
Liz, I saw that you just sent over your presentation. Do you want to share your own slides, or do you want me to share them for you?
I'm happy to share them myself.
Cool. Okay. Thank you.
Yeah.
Annika, you want to give people a few more minutes to join?
Yeah, we'll give them one more minute. I have a feeling
Okay.
more coming. Hi, Julia.
Hi, everyone.
Okay, we can go ahead and get started. I'll run through the agenda really quickly before turning it over to Diana and Meg. My name is Annika Lefebvre. I'm the Food Systems Resilience Coordinator with the Maryland Department of Emergency Management. Today, we are lucky to have 3 invited speakers to join us on the community eligibility provision. We have Julia Gross from Maryland Hunger Solutions, Julie Fletcher from the Maryland State Department of Education, and Liz Marchetta from Baltimore City Public Schools. To close out our meeting, we're going to also have Joe Liu from the Capital Area Food Bank give a rundown of the 2024 hunger report for us. But we can go ahead and get started, and I will turn it over to Diana to give us a welcome.
Welcome, everyone. I don't know if you guys have been as busy as I have this week, but I've had the opportunity to be in several excellent meetings. I was at the Hunger Solution yesterday, which was very, very well put together, and a lot of good topics were discussed. Teresa, I agree with you. I'm excited about this afternoon and how and just to hear the topics that are on the agenda. So I'm not going to take long. I'm just going to just say welcome and turn it right back over.
And I forgot to, thank you, Diana. I forgot to say that this meeting is being recorded, and as of today's committee meeting, we are going to start posting the committee meeting recordings to the council's webpage so that people will have access to them later on. Also, please go ahead and put your name and organization in the chat so we know who's here. Just some quick announcements. We have a full council meeting on November 7th. That is from 10 a.m. to 12 p.m. We have a farmer panel coming to that meeting. Then the Environment and Production Committee is meeting on November 14th. They're talking about farm to institution procurement and farm to school. And then the next meeting for this committee will be in December because of the Thanksgiving holiday. And I did want to share, we have an upcoming Lunch and Learn. We're bringing the Lunch and Learns back. This one is on food as medicine. And we have Holly Freistadt, Evan Lutz from, Evan Lutz from, my mind is drawing a blank, and Dr. Oh, I can't read it. Dr. Moran from Johns Hopkins. Sorry about that, everyone. All right, with that, I'm going to turn it over to our guest speaker since we have such a full meeting. Julia, I have you going first. I have your slides here, or you can share them yourself. Either way is fine.
Great, thanks. Yeah, if you're willing to just click through them, I'm happy to give you the reins on that.
Absolutely.
Yeah, well, thank you everyone for having me here. So my name is Julia Gross. I'm the Senior Child Nutrition Associate with Maryland Hunger Solutions. And I'm always honored to share the stage with Julie and Liz, who are the real experts in CEP. So, hopefully the information that I have is helpful and adds to the conversation and doesn't overlap too much. But feel free to click on to the next slide. I did want to just start with some basics on CEP. I know I'm probably entering a room where folks have a pretty good base knowledge of what the program is, but just kind of wanted to set the stage, and I'll run through these pretty quickly, but feel free to slow me down or ask for more information or clarifications if needed. But CEP is a federal provision that was been established by the Healthy Hunger-Free Kids Act or Hunger-Free Schools Act of 2010 at the federal level. So it allows high poverty schools and districts to provide breakfast and lunch at no charge to their students. This is an option that can be opted into by individual schools. Schools can be grouped together, and then districts can also come on at the district level. And I just wanted to point out here, because it will come up later, that within these options there is no state option right now. So states cannot group every school in the state together and come on as one giant group. This is still a district level decision, and so this is something that FNS directors at the local level have conversations around every year to try to figure out, which one of those, which schools are eligible and which groupings are best. So it is still very much at the local level decision. And then this eligibility threshold for schools being eligible to come onto the program is based on the identified student percentage, which on the next slide we have some more information about. So just very briefly, the identified student percentage is based on direct certification numbers. So it is different from, a lot of folks are very familiar with free and reduced price meal numbers. Those are the numbers that schools get when families fill out free and reduced price meal applications at the beginning of the year. That is one way that kids get certified for free meals. The other is through direct certification. And so that's really the number that we're looking at. Community eligibility schools do not collect free and reduced price meal applications. They just look at this direct certification number. So this is based on students who are in means tested programs already. So SNAP, TANF, FDPR for states that are have FDPR running, and then Medicaid, which is new to Maryland. We just added Medicaid to our direct certification process, and then there are other sources for the state to directly certify students who are in Head Start, who are in foster care, or identified as homeless. So just a little bit more information about where that data comes from. We can move to the next slide. So again, kind of basic information on how schools get reimbursed. So that direct certification number, that identified student percentage, is multiplied by 1.6 to calculate the reimbursements that schools get. And I'm assuming that Liz and Julie are probably going to go into a little bit more details about this, but I just wanted to point out, because I'm going to talk a little bit about funding later on, just kind of pointing out, and we can go to the next slide, that there is a broad range of reimbursement levels that schools have to take into consideration when they are eligible and considering coming on to CEP. So this is just an example, and I won't go through all of these numbers, but I did just want folks to take a look at kind of that first column when looking at the ISP, the level of school or group eligibility. And then that second column, when you take a look at the level of reimbursements that the school actually gets. And then that final column, which is the number of meals that are kind of like left behind. So when schools go through this calculation process, the number of meals that they are getting reimbursed with that ISP times 1.6, though that's the number of meals that they are getting reimbursed at the highest level of the federal reimbursement range. So that is, that kind of like goal level of trying to get, meals reimbursed at that highest level, and then the school or the meals that are left over at the very end that don't get covered within that, 83%, 48%, 100%. Those meals get reimbursed at the lowest range, at that the paid rate, which means they're getting very few reimbursements for those meals. And so just looking at these numbers and noting that at a certain level, at about 62% ISP, schools are going to get 100% of their meals reimbursed at that highest range, which makes it which makes CEP a much more eligible program for those schools. But if you look at, school 2 in this example, they are at a lower level of being eligible for this program, which means that they're not even receiving 50% of their meal reimbursements at that highest level. And so a lot of their meals are coming back and getting reimbursed at that lower range. So that's important to note, because that is one of the biggest challenges that we hear from schools and school districts. One of the biggest pushbacks that we get on talking about CEP is the financial viability of the program. And understanding that there are schools that are eligible to opt into CEP that absolutely is, not a consideration for them, because they, understand that the reimbursement levels that they're going to get is just not going to work out for them and not going to be financially viable. So can move on to the next slide. And sorry, these numbers are a little bit small. So I think, hopefully that was some good understanding of how the program works. And again, I'm sure Julie and Liz will go into a little bit more detail on this, but I just wanted to spend kind of the bulk of my time here talking about opportunities for policy changes to support CEP. Because we as a state have, I think, come a really far way with our CEP, our CEP school numbers here. So you can see this is a 10-year graph. The first year that Maryland had CEP as an option and opted in, we had 5 schools. And those first 2 years, we've learned a lot. And this was before my time, but have heard that there was a lot of struggle when it came to moving schools from collecting free and reduced price meal applications to using direct certification numbers. And that's still a conversation that we have frequently today. But kind of in those first 2 years, it was a struggle for schools who were trying to get state compensatory education funding, and Title I funding and other programs that relied on free and reduced price meal numbers. So you see that first big jump that we have there, starting in school year 2015, came right after the state passed a Hunger Free Schools Act. And so what that bill did is it allowed kind of a grace period for schools to continue using their free and reduced price meal numbers for state education funding. And right after that is when Baltimore City decided to come in at a district-wide level. And so that's where you see that really big jump, and kind of a little bit of growth and fluctuation for the next few years. It allowed more schools to come on board, because it helped the program work better together with the state education program. And so there's a whole nother conversation that we can have around that switch from free and reduced price meal applications to direct certification. But I'll save that for questions at the end if folks want to get a little bit more in depth on kind of how we see that continuing to play out even now. So the next big jump we see there is another district-wide. Keep going with a couple more policy decisions here. That next big jump is another district that came on district-wide. So Baltimore County Public Schools decided to come on at a district-wide. They came at a district-wide level a little bit later than this, but this first big jump, their school board passed local policy that required all eligible schools to come on board. So they moved from 4 schools to 87 schools. So really important kind of local advocacy there, with really strong champions at the school board level, as well as a new food nutrition service director who had more willingness to come on board. And then that last big jump that you see, I think, is the most one of the most important changes that we have made. We see this as a change at the federal and state level. At the federal level, the option to include Medicaid data in that direct certification process became available for all states to opt into, and Maryland fortunately made that decision to opt into that and add Medicaid to direct certification. So this has been, I think, the biggest game changer for us as a state in terms of CEP eligibility and financial viability for school districts. Bringing on that Medicaid data into direct certification allowed the state to directly certified, I think, of over 110,000 extra kids across the state, which, of course, added to the identified student percentage and then increased the federal reimbursement. When you multiply that by 1.6, increase the federal reimbursement calculations for a lot of schools. And so we've seen a huge increase, huge growth, which of course is great, I think, for the districts that are, have experienced free meals throughout the pandemic and are coming out and realizing the need. So having that Medicaid direct certification process integrated into our state has been just a huge game changer. So you can move on to the next slide here. So I won't go through all of the federal legislation in play here, but did want to list out some legislation in case folks wanted to look into it. I think the biggest thing I will note here is that the support to CEP, a lot of it we would love to happen at the federal level. There is almost no way for individual states to come in and completely make up for the lack of reimbursement levels that we have at the federal level, at least in a sustainable way across the board. I think we in Maryland have a really good opportunity to to supplement some of these potential changes and to step in. And, we are, I think, one of the more likely states to make that move. But we also recognize that there's not really a way for us to ensure that all kids across the state have kind of equitable access to these changes and supports unless it happens at the federal level. So there is a lot of advocacy going on here. I think two of the really big pieces that we would love to see happen for CEP is an option for the states to implement statewide CEP, and also an increase to the reimbursement levels that schools can get. So right now, I mentioned that there is a 1.6 multiplier, and that is the cap for the multiplier that we have. That's the maximum level that USDA is allowed to include in that reimbursement formula. So we would love to see that multiplier increased, and a number of these bills in here, these potential bills do include an increase to funding and an increase to that multiplier. So that's a really important piece that we are advocating for at the federal level, as in addition to a number of other things that could be done, including that first one there, which is the dream goal of creating just a nationwide healthy school meals for all program. So all of these are listed. I did actually, if these slides are being sent out afterwards, I did put a link in here so folks can learn more. There's a FRAC Healthy School Meals for All Leave Behind. That is the Food Research and Action Center. So we're happy to share more information about these bills if folks are interested in federal level advocacy. And then I think I have one more slide here on state opportunities. So like I said, Healthy School Meals for All is the dream. There is legislation being introduced, which did not pass, unfortunately, in the past 2 years, but it is coming back in 2025. So look forward to, if folks are interested in staying in touch about that, you can feel free to reach out to me, and I'm happy to add anyone to the coalition list. And then I know there's a lot of other there are a lot of other supports that we could give to schools in terms of funding. So this is just kind of the beginning of the conversation, but I know this was a presentation on CEP opportunities. So did just want to add in there that there are always opportunities to support CEP. I know, there's a lot of concern around budget in the last year, in this upcoming year. And so understanding that some of these lofty goals may have to be drawn out over the next couple of years. They may have to, be scaled down. So I did want to put in here that there is always an option for including support just to CEP schools, covering that paid rate. So, kind of what I was mentioning in that chart a few slides ago, a lot of schools do not meet their eligibility threshold, doesn't meet the level where they get 100% of their meals reimbursed at the highest rate. And so there's an option for the state to come in and potentially try to bridge that gap and allow schools to get that full reimbursement. So with the low eligibility threshold that we have now at 20, so looking at schools over 25%, ISP and the Medicaid direct certification numbers that have really bumped up the data that we have to make schools eligible. We actually have a good number of schools that could potentially be covered by CEP if it was financially viable for everyone. So looking at the districts, there are 20 districts that are at that 25% or higher, plus other schools in the other 4 districts that aren't eligible district-wide. And so we could be covering around 90% of our students if CEP was fully realized, the participation in CEP was fully realized, but then also just recognizing that school districts need more support to be able to make that happen. So I'll stop there because I know we have some other folks to give some more great information, but happy to stay on and answer any questions that folks have afterwards.
Thank you. Thank you so much, Julia. That was really helpful. We're just going to keep moving through our invited speakers, and then if it's okay, we'll ask questions at the end, and maybe everyone can help answer them. Thank you. Okay, and so our next speaker is Julie Fletcher from the Maryland State Department of Education. Welcome, Julie. She is the Executive Director of the Office of School and Community Nutrition Programs.
Thank you, Annika, and thank you, committee, for having us today. I'm going to go over a little bit of what Julie went over, but have from the state perspective. Just a little background on me, because I've only been in this position not quite 2 years. It'll be 2 years next month. My prior position was with Dallas Independent School District in Dallas, Texas. And when I joined them in 2015, they had already moved to district-wide CEP. And just the background that I know on Dallas, it was such a relief to be out from underneath the burden of processing hundreds of thousands of applications, first on paper and then electronically over the years, that they could divert all that money that was spent on applications back into the program in other ways. So this has been a wonderful program for so many districts to be able to implement either partially or fully. So next slide, please. Okay, we can pass on that one too, except the pictures are nice. Okay, so the community eligibility provision came out of the Healthy Hunger Free Kids Act back in 2010. And as Julia said, it allows high poverty schools and districts to serve breakfast and lunch meals to all enrolled students without the household applications. So they don't have to send the application home in the backpack and hope to get it back, or try to make sure everybody gets access to the link to complete an application online. So next slide, please. Some of the benefits that we see from the state level, it increases participation. As we're putting together a report for the legislature for this legislative session, in studying the other states that have implemented CEP, Meals for All, it has increased participation at both breakfast and lunch. So of course that expands access for children to nutritious school meals. It does minimize peer group stigma. Kids that normally would not participate now participate. It improves the learning environment because everybody's less stressed about mealtime and all that. We also find that in improving program efficiency, as I said, they're not working on applications. They're able to turn those funds to other means like improved food or more training for staff, more local food purchases. But it also, one thing that we found is it also has increased time for the kids to eat, because they're not, they're able to go through the serving line faster. They're not being stopped and having to collect money or, making another calculation on the checkout. It's just go, you're good, you're good, you're good. So the kids actually have more time to eat. And of course, it eliminates the unpaid meal balances is a huge benefit for every district. And especially since the pandemic, it's been, we have children coming into the system that have never known, and their families that have never known anything but meals at no charge. So now it's something that the districts are contending with is meal debt. So next slide, please. So the eligibility, they can do a single school, a group or groups of schools, or district-wide. They calculate that at that ISP, that identified student percentage, to the 20% that Julia said that just came in last year. But they do also have to participate, so they have to register with us here at the state to operate both the breakfast and the lunch programs. Next slide, please. So they're approved to serve CEP by the state. We review them and all that. So they have to offer breakfast and lunch to all students at no charge. They have to cover any operational costs of providing meals to students that they're not getting the full reimbursement for. So that could include other available funds from state or local funds. And as Julia mentioned, that is a huge concern, because just as a reminder, the school nutrition budgets in a school district are separate because they're federally funded. So they're not part of the general operating budget of the school district. And so the school nutrition programs have to work to be break even on their budget or better every year, because they don't want to take money from the general fund. So they have to let us know that they intend to participate by June 30th. Next slide, please. And so as Julie went over, the directly certified for free meals based on their participation in other programs such as SNAP, TCA, Medicaid. I came on board just as that project was finishing up here, and that's amazing to see how they put together. We have a software system that the districts can upload the student information to, and it goes out to Department of Human Services and Medicaid to make all these matches, and comes back to the district. And of course, it's all encrypted and encoded and all. And then it goes back to the districts, and then they get that list of identifying those students that are qualifying. So next slide, please. So again, these are the ones, as Julie mentioned, that are designated by the local school district, so that they can add homeless children, runaway, migrant, foster, and then the Head Start, Early Start, Even Start to their directly certified list. So that increases the numbers for them. All right, so you ready to do some math? We'll do some more math. So we calculate the number of identified students divided by the number of enrolled students times 100 to give that ISP. So, so in our example here, we have 500 enrolled students. 315 of those students are identified in one way or another. So that gives us a 63% ISP. So that's greater than 25, which is great, but it's also greater than the 62.5 that would qualify them for 100% free meals. So this school would qualify for 100% of their meals being reimbursed at the free rate. And let's see, the next slide, please. So we validate, we look at the district data. They have to send their data to us, and we review it. We work with them to see if there's any questions. We check their ISP rate through a method we have, especially for new elections or any changes. But in either case, that ISP percentage for either an individual school or a group of schools or the entire district is valid for 4 years. So they use that rate every time they send a claim to us for reimbursement. They use that rate. So they're using data as of April 1st. So the good thing is if they reassess their ISP each year, and if it goes up, they can reapply and get recertified and start a new 4-year cycle. So they're not penalized if their ISP goes up. And if it goes down, they don't have to reapply. So next slide, please. So as I said, the ISP is multiplied by 1.6. And then if it's not 62% or 100% free rate, the rest of them are paid, reimbursed at the paid rate. So they would have this. Our example school would result in 100% reimbursement at the free rate. Next slide, please. So where's the 1.6 come from? analysis conducted at the time that the legislation was going through that they tested, verified, I'm not sure the process, but for every 10 children that directly certified, up to 6 additional children were eligible. And that's due to accounting for parents that would not fill out an income application or would not apply for benefits. So looking at probably statistical or income information that's available, they've figured that another 6 children for every 10 would qualify. So next slide, please. One thing districts have to do is they have to be proactive in communicating out to their families that the meals are at no charge, and how to access the menu and how to notify the district if their student has any disability-related special dietary needs. All of our districts do a great job with outreach. So, but this is a key component of the community eligibility program. Next slide, please. So, grouping schools, the LEAs get to determine that. We don't play a part in that. They can group 2 schools together so they get 100% of their meals reimbursed for free over here, or they can group 7 schools, or they can do 1, or however it's most beneficial for them. They're usually looking to maximize that federal reimbursement. Next slide, please. So yes, if they see a change in their student population, they can reassess their ISP and they can reapply if they want to. Next slide, please. The direct certification, I will have to tell you, as Julia showed, that increase just in this last 2 years of school districts that have come on due to the Medicaid matching has been a very good financial part of the decision making. Thank you. I was going to mention Allegheny County just went 100% community eligibility. So it's really showing that it's finding those students that qualify and showing that it can be financially viable for a school district to do it. It does indicate the district's poverty level, but it does enhance the integrity of the programs because it's so much easier to feed all the kids. So next slide, please. And of course, it's the government, so we have to have record keeping. So every district has to maintain their records for 3 years plus the current year. And because we go in and review them. And so we're going to validate when we go in for an on-site review, or is that they're validating their ISP and validating their CEP calculations. So, and there's, information they have to keep on hand, especially the students that they locally identified as directly certification. We need to see that documentation too. All right, next slide, please. Yeah. So again, more records they have to keep with the October 31st eligibility data from the year before. And that supports compensatory funding. I know that's still a concern and a question, but I'm sure we can figure it out because the ability to provide meals at no charge is such a help for our students, and it helps with the school day. It makes it easier. It's less stressful for everyone involved. And it's a great way to ensure the next generations have the nutrition that they need. Next slide, please. That's it, but I have to show you one more there you go. I have to show that one. So thank you. I appreciate your time and look forward to any questions you have.
Thank you so much, Julie. That was really helpful. And last, we're going to move to Liz Marchetta, and she can talk about how things are going at the local level with Baltimore City Public Schools. And Liz, I will stop sharing so that you can.
Okay. All right, are you able to see my screen?
We can see it, yes.
All right. Well, thank you so much. I appreciate the two prior presenters because I'll be able to go through some stuff quickly. I just appreciate the invitation to come and speak about community eligibility from the district level. So just three kind of things I wanted to do in this presentation is talk a little bit about our district, give a little bit of an overview of meal programs in city schools, and then address some of the questions that were shared with me specific to CEP. So in Baltimore City, we have 160 schools and programs. We actually have more cafeterias than schools and programs just because we have some schools that have multiple buildings, et cetera, et cetera. We have over 75,000 students enrolled in this current school year, and the student demographics are listed there. You'll see our most recent low income measurement is 72%, and that is really based on our direct certification data, since we no longer collect income applications. In city schools, we are very fortunate to offer all of our meal programs for free to students, regardless of
Sorry
their
to interrupt, Liz.
Yes.
It's the slides aren't advancing for us. They're just on your first slide still.
Oh, okay.
It's Google Meet. I'm sorry.
Let me try a different way. All right, how about now? Can you see the current slide with schools and programs?
Yes, we see that.
Okay. So like I said, we have 160 schools and programs, and then 75,000 students. This again is the list of our meal programs that we offer to families. And this is just a snapshot since 2017-18 school year, which actually is after we adopted CEP, but it's been so long that it doesn't fit on the screen with last year's participation data. So I just want to show this to show participation in meal programs. This provides the daily participation in breakfast, lunch, snack, and supper. And the correct way to read it, if you're going all the way to the right, is for the 23-24 school year. We served 43,257 lunches on average every school day. And that represented about 50% of our enrolled students. In total, last year, we served 12.4 million meals to students across these 4 meal programs. So, you know, there's a lot of food going out the door here. So just to talk briefly about meal programs in city schools, you know, this has been something that has been, I would say, over 100 years in the making of our current state. So in 1926, I love to share this historical tidbit. This is a statement of profit and loss from Frederick Douglass High School cafeteria. And you can see here that one of the most popular items that they were actually serving was ice cream. We're not in the state where we're providing ice cream to students. This actually predates the National School Lunch Program at the federal level. But all that to say is that kids were eating food at schools before USDA ever was funding it. In 1960s and 1970s, we actually saw the dramatic expansion of the National School Lunch Program in Baltimore City schools. And again, this is linked in the slides that will be shared. But this is some Senate testimony to Bob Dole, where the food and nutrition director from Baltimore City at that time was talking about having to increase and provide meals at all schools. So in 1968, they had 72 out of 200 schools at that time that didn't have any lunch offered at all, regardless of free or paid. They just provided no lunch whatsoever. And as a district, they were serving 1,500 lunches. And then by 1970, they were able to expand it. So all 200 schools had some type of lunch option available to students. You know, again, it wasn't all for free, but basic provision. And they were serving 32,000 lunches a day by the end of this expansion with 1,800 staff. And to give people, you know, a comparison, so they were serving 3,200 lunches, or sorry, 32,000 lunches a day with 1,800 staff. And last year we were serving 73,000 lunches a day, and we have less than 600 staff. So we are doing a lot more meals right now with a lot less staff. And that is one reason why they are, less complicated meals than some of the scratch cooking people might have been used to back then. In 2011, Baltimore City Schools actually offered free breakfast for all students through the Provision 2 program. So this is a copy of that, policy statement. This was a, not quite similar to CEP, but predated CEP as a way to get free meals out to students. And we only offered it for breakfast during this time frame. In 2013, the district evaluated our meal participation rates, and you can see on here the breakdown of the average daily participation and the percent participation by eligibility status. So we have the free, reduced, and paid groups listed here, and you can see that 38% of students who qualified for free meals were eating breakfast, but only 33% of students who qualified for reduced price meals were eating breakfast. So those numbers are slightly different, but they're not too far apart from each other. And just remember that breakfast was free for all students at this point. But what we did see was that there was a wider gap. Obviously, students who qualified for reduced price meals had to pay a 40-cent copay. But we saw that there was a 20% gap in their participation rates. And when we did the calculations, we actually saw if we were able to increase the participation rates among the reduced qualifying families, we would actually cover the loss of that 40 cents that we were collecting from families. So that was a district level decision to eat the cost of that 40 cents. But because the participation rate went up so significantly, it actually was able to cover its cost. So in this year, we were serving free lunch to any students who qualified for free or reduced meals. And then in June of 2015, we couldn't wait until the end of the school year. Once the state legislation was passed that Julia mentioned, we signed up for June 2015 for community eligibility. And you can see the real comparison in the participation rates here between the 14-15 and 15-16 school year. We served over 10,000 more lunches every single day in our district. And over the course of the year, that was almost 2 million more meals. So it cannot be understated how significant the impact of that was. And you have to bear in mind that in 2014-15, we were already serving around 90% of our students meals for free. So a lot of that increase came from students whose families did not qualify for those meals, which really does show that we are missing kids, and just because kids' status or their family's income level qualifies them in the paid category, it doesn't mean that there isn't food insecurity in those households. So these 5 questions were shared with me, and I just wanted to do a quick answer for some of them. So what factors require or enable CEP to be more cost effective for than processing individual applications? My first job when I worked in the food and nutrition department here was processing these applications. This is a screenshot of the last applications we ever did, and they were monsters. I don't know how else to say it, but anytime you're collecting, for us, it was like 100,000 applications, and trying to do that in a way that doesn't identify students. That was an absolute mess. And, while we offered a digital online application for a few years, we really were very heavily reliant on these paper forms, which even from someone who completed graduate school, I found very, very confusing. And then you have to factor in the logistics of collecting those applications, looking for errors and making sure things are reported correctly. I cannot underestimate how complicated they were. And it was a really all hands on deck approach. It was not just limited to the food and nutrition department. We had to work with teachers and principals to make sure that these applications made their way back to our office. And we would hire about 12 temps every year to assist with the processing, scanning, and uploading of these. And unfortunately, the worst part is that if your parents did not return this within the 30 days, you know, at some point you're going to be cut off from that free meal access. So there's just no way I can understate how horrible it was, you know, for students to be relying on their parents filling out a form in order to be able to, you know, eat a meal. The next question was, what is needed for a school system to qualify for CEP, which is not an answer I can give. So there's a link to USDA's form. Asking about if Baltimore City observed reduction in food insecurity among students since implementing CEP. Well, I will point you to the guidance. Actually, Maryland Hunger Solutions and Susan Gross from the School of Public Health at Hopkins did an excellent study looking at household food security status, where they compared similar schools in Baltimore City and Montgomery County and found that CEP, you know, reduced the odds for being food insecure at the household level, and that students were twice as likely to be food insecure in the households in Montgomery County that were eligible for CEP but not participating in it. So those were, you know, pretty shocking results from how we think about Baltimore City versus Montgomery County, but really does emphasize how important this program is. I, you know, don't really have a whole lot to talk about in terms of additional research that is Baltimore City specific, but there is a lot of information and research out there right now about community eligibility to support looking at these other metrics. But I think it is really important to point out that school meals are the, you know, healthiest meals that are out there, and have been shown to support academic achievement and alleviate poverty. So anything to promote access to that is positive for us and for our families. Also, since the pandemic ended, Baltimore City has seen, you know, a larger rebound in its meal participation rates, and I do credit a lot of that to community eligibility and not having to worry about collecting household income applications. The question if we think it would be beneficial for other Maryland districts is a big yes. It has made our lives so much easier. It has made our lunch lines so much smoother. Students don't have to enter individual PIN numbers anymore. You don't have staff taking food away from kids, which is not what anyone ever wanted to do. But that was a necessary thing when over a quarter of your district's budget is tied to the collection of those income applications. So for us, when we joined in, the compensatory education funding was the thing that prevented us from joining. And that represented at that time over $330 million coming into the district annually, whereas the budget for the food and nutrition department was, you know, around $50 million at that point. So we could have decided to feed all kids for free on our own, and it would have been a less risky financial decision than to switch to community eligibility at that point because of the impact it has into other money coming in the district. And then the last thing is trade-offs and barriers. So again, there are trade-offs and barriers. And for us, we really do not have sufficient federal funding to run the program that we would like to. Even though Baltimore City is reimbursed at the highest possible level, so they went through these identified student percentage calculations, we get reimbursement at the free level for 100% of the lunches we are serving. That had actually dropped down right before the pandemic. It went from 100% to 92% because there were some decreases in SNAP rates. And from one year to another, that meant we got $4 million less dollars than we had the previous year. So, you know, even at 100%, with the food costs increases that we've seen and with the necessary increase to wages that we've been paying to our employees, it has been increasingly impossible to cover the cost of running a meal program at the federal reimbursement rates. So I say that not to scare people off, but just to acknowledge that, you know, $4.50 is not enough in today's world to provide the food, a high quality meal, and to be paying people livable wages. This was just an outtake of some things, that we used to guide our meal application collection back in 2012. And so again, only at the very bottom is this related to food reimbursements. It doesn't just impact the money that comes into the district, but how we measure poverty also really impacted the distribution of other funding sources. So there was Title I. At the time, the district used a model called Fair Student Funding. So it allocated funding within the district based on this poverty measure, as well as things like E-rate. Now, the state funding for poverty has changed significantly since this time. So, this is no longer completely accurate, but it is still something that really does impact and constantly comes up in discussions about the trade-off. And just, this is a show of some not so recent financial data. It's a year old, but it really does show you that the cost that we've been experiencing is not sufficient enough to be covered by the federal reimbursement rate. With the pandemic, we've also seen a lot less operating days, just people taking more sick days. We've seen virtual learning days where students are learning at home, so they're not coming into school to get a meal. And one missed operating day costs us over $300,000 because we're paying staff, but we are not able to get any revenue because kids are not in buildings and we're not serving them that meal. So since the pandemic, in addition just to the skyrocketing food costs, we've also seen just it's harder you cannot feed kids if they are not in school. So that has been a struggle for us. And then the last thing that I just want to point out, we're very, very proud of offering what we feel are very high quality meals to our students. But I think it is really important to remember the people that are serving these meals and preparing them for our students. Again, we have less than 600 staff that are serving over 70,000 meals a day. And while we were able to implement some new increases to our food service worker and manager wages over the past few years, that has really cost us. And we lost over $5 million last year from our fund, and that had to come from general operating funds from the rest of the district. And it's not a good position to be in, to be taking from the other funds in the school district. So no one really feels great about food and nutrition when you're doing that, but you don't really have another option. And at the end of the day, a lot of that has to do with the fact that we're paying staff more livable wages. But even with that being said, if our food service workers have one member in their household, they are eligible to get free meals. So we are, I think, paying a lot of people to live in poverty, running a program that is about food security. And I think it is at least worth pointing that out and recognizing that, because ultimately we can continue to expand these meals, but without sufficient federal funding, we're either taking from the quality of the meals or we are taking from providing livable wages for our staff. So that is the end of my presentation, and I will hand it back to our facilitator.
Thank you. Thank you so much, Liz. A lot of really helpful information about implementing this at all levels. I'm going to turn it over to the committee now for questions for our three speakers. And I have some if you don't. I'll kick us off. So Julia and Liz, the FSRC has been tasked by statute to, quote, explore the role and potential for the community eligibility provision to ensure that all students in the state are fed and make recommendations to the Maryland General Assembly and MSDE about their findings. I guess I'm curious, since that legislation was written a few years ago, what you think, from your perspective, would be helpful now for Maryland to keep advancing this program?
going to be in listen only as the state, so.
Yeah, I'm happy to hop in on that one and continue to advocate for more funding. I know that's probably the not always a helpful recommendation given the financial and budget constraints of the state right now, but that's really what is needed to support these programs. We've been lucky enough to be able to talk to multiple FNS directors across the state, and I don't want to put words in their mouths, but I would say that none of them are, dreaming of having a program that just makes ends meet every year. Everyone is looking to expand these programs. Everyone wants to, procure more locally sourced foods and increase and expand menu items to be more culturally relevant, pay staff more, upgrade kitchen. Like, there's so much that we need to do to support these programs to make sure that they are not just adequate for feeding our kids, but actually growing, and that we have a robust meal program in all of our schools, because that's what our students deserve. And so I see CEP as a really important piece of this, because it is the only option we have right now to make sure that all students are being captured. We don't need to put staff time and effort towards collecting meal debt, collecting free and reduced price meal applications. We can really build off of an existing federal program that allows schools to just focus on feeding kids and feeding kids well, and not, being debt collectors. So it is really important. And I think being able to maximize our use of this program as a state is key to moving us forward in the journey towards healthy school meals for all and getting a universal meal program established within Maryland. But that can't happen, I think we all touched on it at some point. That can't happen if the reimbursement levels aren't there, and the schools that are eligible aren't able to make those reimbursement levels that are financially sustainable. So just making sure that the state understands that and is putting adequate support and funding towards these programs.
I would just piggyback on that and say to give Julie more money, because I know she wants to do it. It's just a matter of having the resources. And unfortunately, the additional dollars devoted at the state level are not sufficient. I've been making a lot more of a case for there needs to be local contributions to support a high quality meal program, but I'm working in one of the highest poverty districts in the state. And that's hard when you're competing against other things in education.
I'll throw in another question for the group. So the Prince George's Food Equity Council had their meeting on Tuesday, and they have just completed an interesting study about school meals. And I believe they are a district that has implemented CEP. One of the things that they talked about were different hurdles with implementation that they're trying to navigate. One that comes to mind is that parents had a hard time finding school menus, and so would often not know what their kids were being served, and would then sometimes send them with food anyway. So there was some amount of food that was going uneaten. Have you experienced that, Liz, in your district? Or Julie, have you had any feedback from any of the local education agencies about implementation challenges?
Liz, go ahead. I don't really have anything that I can share at this time.
Yeah, I'd say I'm sure PG has their menu posted because Julie's team will look for it. Is it easy and accessible? That's a different question. And I know that we struggle with that too, is, making sure that people are aware of the services that we're offering. We have really fought hard to try to do our own marketing campaign and stuff distinct, because you can go on your, Google Maps or whatever and find a rating for a local restaurant. We would like that same level of attention to marketing for our cafeterias. But, menus should be posted, but I do understand that it can be difficult. Another thing that we've seen since the pandemic too is a lot of food substitutions. So for a while there, it was really hard to be sure that what we had planned for it to be on the menu and worked with our suppliers to make sure available was actually what was going to be delivered on any given day. So sometimes the menu does not always match what is ended up being served, but I do know, that it is available. I will say, with as many meal programs as we are running, we don't even have enough really room on the menu to really put pictures or make it as detailed as we would want, just because we try to, make it one page. But certainly having it available online is one option. Having it posted at schools is another, requirement. But we're not really at the point where we're papering home menus each month. And unfortunately, I do think that that is missing some families. Not that I'm trying to promote more paper going out, but, it does meet certain families' needs. So.
Well, and I would just add that, each district manages their program themselves. We oversee and check them for compliance, but the district designs their website, the district designs their communications, the district design, and then the food nutrition department works within that structure that's that the district has set up. And that's where it's going to vary from district. So if we have
Julia, you're breaking up. You're breaking up.
Oh, I'm sorry. And it's great to have community input to help you see what maybe you're not seeing in your program. So, that's an important part, is including your community in your program as you can.
We have a question here in the chat from Joe Liu. Does CEP create opportunities to expand procurement from local producers or integrate health or nutrition education curricula?
I would say no, just it's not really the point or purpose of the program. It's not explicitly tied to either of those things. Yeah. Those opportunities exist. I would just say they're not explicitly tied to CEP.
I have one more for you. So the Food Research and Action Center actually just last week had a webinar on CEP with speakers from across the country, and something that they talked about was school districts having to roll back CEP following the pandemic, and what that was like for the actual schools to have to navigate that with families. Has that happened in Maryland at all? Do you see us going in a certain direction with CEP?
I'm not aware of any of our LEAs having to roll back, but I can see where the demographics changed for a school or a district that they would have to reassess.
Yeah, and I would just add, I think we as a state are kind of in a fortunate position of when we came out of the pandemic. That was when Medicaid was added to the direct certification process. So I think because of that, we've seen a really big increase in the number of schools that are eligible and participating since the pandemic. But I know before the pandemic, we did hear a couple of school districts talk about how they lost access to CEP from time to time, just because of that identified student percentage number. It is locked in for 4 years, but a lot can change in 4 years. And so if districts aren't kind of like keeping tabs on that, or if there are shifts in, SNAP eligibility populations, then it can change, and there can be loss of CEP, which I know is really tough. I also know that, and I'm sure, well, maybe Liz, you can't speak to this because you have been district-wide for so long, but the districts that are using partial implementation of CEP, like that is something that a lot of directors come back to every single year to look at their numbers and see, which groupings make the most sense. Can they add more schools? Does it make sense, to increase reimbursements and change those groupings? So it is a lot. There is a lot of work that goes into that. And I think we've mostly seen just increases over the past few years. But there are a lot of factors that go into school districts making those decisions.
Yeah, I don't think we would ever be interested in rolling back CEP. I don't think our community would let us, as long as we were eligible to do it. But ultimately, where does the funding come from to support the program? Because you can't say, like, I ran out of my budget in April. You still have to feed kids through the rest of the year. So it is, it's a funding issue, ultimately, I would say. I don't think there's a single food and nutrition department that enjoys the application process. I think everyone would just want to feed kids if we were funded to do so. But ultimately, the district has to determine how they spend their money. And if your food service operation is operating at a loss, you're going to have to figure something else out.
Thank you. That was really helpful to hear. Does anyone from the committee have any questions for our panelists before we let them go?
It's not a question. I think I just want clarification. So most of the schools, and you may have said it and I just didn't hear it, most of the schools that implement CEP are running in a deficit?
No, I can only speak for Baltimore City Public Schools. But we are currently, yes, last year we ran at a deficit in excess of $5 million. And that did not come from the food and nutrition department. But I cannot speak for any other districts, although I would love for Julie to, I'm sure the state knows, so maybe she'll let us know.
And Beth, I hate to call on you, but do you have any information from your county, or are you implementing this program? Beth Brewster.
Yeah, Diana, way to call me out.
I know.
Yes, it's our second year for CEP. And we are not running in a deficit. I think things are a little bit, every district's different, right? Volume cures all evil. As I said yesterday with Julia, is, the more people you have participating, your expenses go down, right? Because your meals per man hour go up. So we are not. So the CEP has been great for us. I mean, we've definitely seen an increase. It makes it much easier in our office. But then again, we are the third poorest county in the state of Maryland. So our rate was pretty high. We're like at 89%. So we have to do 11% of that match to it. But we run, what was I just looking at? I mean, our participation is pretty high for breakfast and lunch. So again, each district's different. And I have 5,600 kids. Liz has what, 500,000?
73,000.
So.
Thank you.
Any other questions from the committee? Okay, hearing none, I'm just going to say thank you to our three panelists. This was very helpful for this committee. And I think you've given us a lot to process. Next up, we have Joe Liu from the Capital Area Food Bank, who's going to talk about the 2024 hunger report. And our panelists are very welcome to stay on and listen to that as well. Thank you again.
Thanks, Annika. Let me pull up my screen.
And I have it too if you need, Joe.
And of course it is, I'm having trouble pulling it up for some reason.
You want me to share it for you?
I think I can, here we go.
Okay.
Let me. And start the slideshow. So I'm going to try to go through this pretty quickly to leave some time with some questions. So if I skip over too much or anything, we can always loop back around at the end. This is our 5th year of producing the Hunger Report. We partner with the National Opinion Research Center at the University of Chicago. And it's a big, robust survey of 3,800 people across the DC metro area. So we can get data, statistically reliable data down to the county level. For purposes of this committee, it's important to point out that our service area is only the DC metro area. So we only include Montgomery County and Prince George's County in our analysis, and the Maryland Food Bank covers the whole rest of the state. They've got a much bigger job in Maryland than we do, but the scale of the population in the DC suburbs is quite large, and certainly in the food and security space, there are some prominent concerns here. When we look at the two relevant counties, Prince George's and Montgomery, we found both wide variation and alarmingly high rates. 50% of the population in Prince George's County reported food insecurity, and over a third, 34% in Montgomery County did as well. So even in the wealthiest county in the state, we have significant food security issues. The 1 out of every 2 residents in Prince George's County really is quite striking. When we look underneath that food insecurity number, we can divide that population up into those who are very low food security and those with low food security. And we use US. Yeah.
I'm not sure if you're advancing your slides yet, but we're still seeing the first one.
Oh, I am only seeing my later slides. I'm on slide 6. I wonder why.
I think PowerPoint is not the most compatible with Google Meet sometimes.
Do you think it's a lag or?
No, I think I just attended another meeting where this happened too. I think it's an incompatibility thing with like presenter view for whatever reason.
Well, then
Can
why don't you try it then?
Oh, sorry about that.
No problem. No, I'm sorry that I hadn't realized we were there.
No. And so which one do you want us to be on?
Slide 6.
This one?
Yes. So the very low food security group are those who report real problems putting food on the table. Frequent disruptions, numerous disruptions over the course of the year. While the low food security group have more occasional changes in their diet, but do not report as much skipping meals and things like that. So there is a difference even within that food security, low food security group. Next slide. And I think we know a lot of this story already, but if we trace what's happened with price inflation, wages, and SNAP since May of 20 with the pandemic, it's a familiar story. That black line is inflation. Wages at the green line have not kept up. And for a while, we had SNAP really filling in that gap, going way above the inflation rate in benefits. But that's now dipped down. And so families, as we're hearing over and over again, are having a hard time with food inflation, having a hard time. And even though the economists keep telling us, well, wages are now growing as fast as inflation, when we look at it from when the pandemic started to now, they haven't caught up. And that's what people experience on a day-to-day basis. Next. And the trade-offs that people tell us are all familiar. They start off with the discretionary things like transportation, car repairs, gas, but it's all the essentials of life: credit card bills and other loans, rent, housing costs, utilities, and healthcare. We were impressed by how high a number school loans, tuition, and educational expenses were as a competing demand, and that speaks to the food insecure population that we'll see on the next slide. I think contrary to public imagination, but probably not for this group, the food insecure population is employed. In fact, in our data, at a slightly higher rate than the food secure population. And we found that 58% of the food insecure had some college or a college degree. So this is not a stereotypical, extremely low income group. These are the working and in many ways the middle class, which we'll get to in the next slide. We actually found that between the previous year and this year, the worst change in food security was among those in the middle class. There was a big bump in food insecurity among those making between $100,000 and $150,000. And when I saw this data, I wrestled with the question of, wow, I thought these were folks who made it, making six-figure incomes. Isn't that enough? You can afford some luxuries in life. And too many of our neighbors are reporting that they're still facing food insecurity at those income levels because of how extreme the living expenses are, certainly in the DC metro area. When we look closer at PG County on the next slide, sort of magnifies this dynamic. Among those in the bottom third of incomes, there's a relative stability, though a very high rate of food insecurity, but this big jump in the middle income group from 29 to 44% last year is a phenomenon we really hadn't noticed before, and prompts a whole bunch of questions for us on what we should do. Next. As we all know, the effects of structural racism and disparities across racial and ethnic groups persists, and we find with food security, people of color are 2 to 3 times more likely to be insecure than whites. But the African American and the Latino food security rates were exactly the same at 53% insecure. Next slide. The food insecurity rate for children is significantly lower than for the population overall, because parents do things like eat less so their kids can get enough. But when we look at the number of food insecure children, there were 103,000 in the DC metro area. Prince George's and Montgomery County made up 61,000 of that. So it's a disproportionately large percentage of the food insecure children in the DC metro area were in Maryland, which again was a little bit surprised by and didn't quite expect. Looks quite different on the next slide when we look at seniors, with fewer than 250,000 seniors being food insecure in the DC area. Prince George's and Montgomery added up to fewer than half of the food insecure seniors. So there's a difference between the kids at the ends of the age spectrum, and probably worth some investigating and further understanding. Next slide. And this last slide that I'm going to cover raises questions for providers like us at the food bank, because we found that about half of the food insecure were not accessing charitable food. It was a teeny bit lower in PG County and Montgomery than in the rest of the DC area. But it forces us to look at questions like, can we do a better job on awareness? Can we make our services, our food distributions more convenient, especially when we think of that food insecure middle class working family? And then a big issue, and maybe a bigger issue for that population, are the potential stigmas that come attached. So how we shape our programs to be more customer friendly, neighbor friendly, and think about ways that fit into the lives of the people who are actually facing insecurity. So that's a tough set of questions we want to ask. And, you know, it also prompts a big question that we've been wrestling with at the food bank, that we often think about what we do as filling in the cracks of our social safety net. But when we start identifying so many food insecure families in that middle income range who are on the other side of the social safety net, who aren't really the intended beneficiaries of the safety net, how do we as charitable food providers both catch people falling through and those on the other side of that, the income scale? And you know, are the ways we've traditionally done our work probably won't fill that need. And so we have to think about new and innovative approaches. With that, I will skip talking about how to address, because this committee is supposed to think about that. So I'll turn it over to any questions if you have any.
Thank you, Joe. And I feel lucky that this was my second time I got to hear this.
I'm sorry you had to.
No. So I really feel like I got to digest it a little bit more. Does anyone from the committee have any questions for the Capital Area Food Bank?
No, I just want to say thank you, Joseph, for sharing. I did find it to be alarming, the percentage of people that are not actually utilizing. And I wonder, as soon as you said it, I often think, is it because of stigmatism and the other barriers they're at work. So most distribution sites are closed when they're off.
Exactly. I think those are big issues that we have to figure out how to do better on. So you're absolutely right.
So that brings me to another, just something to throw out. I wonder how well the Pratt Library is doing with their grocery store. And to me, immediately that removes barrier and stigmatism. And could some more things like that be implemented throughout the state of Maryland? And then where did they get the funding for it?
I think jumping off of that, Diana, too, I don't know if anyone else saw that story this morning about the new food pharmacy in DC that the Capital Area Food Bank is promoting. Are there more opportunities like this, Joe, for providing food access that might not feel like the typical charitable food?
Yeah. I wonder if Meg is still on to talk about Pratt. No. And on the food as medicine side, we've got about a dozen separate programs and pilots on food as medicine with over 1,000 people enrolled and getting served. And it's a huge potential growth area where we think we have the opportunity to both improve food security and reduce the healthcare system's costs, expenditures. We've done a bunch of research studies that seem to have that impact. And in DC, they're trying to go to scale with an 1115 waiver. We'd love to see progress in Maryland and look forward to the Lunch and Learn in December.
And there's been a lot of, I know we're at time now, but there has been a lot of conversations in the last couple of meetings that I've been attending about food is medicine. So, in saying that, Annika, do you want me to just go ahead and close? Or does anyone else?
You can go ahead.
Does anyone have any ask or updates about things that are happening? If not, I want to thank each and every one of you guys for coming on and joining us today. I want to thank all of our presenters, for those that are still here and those that have moved on. Thank you for such a wonderful presentation today. And I'll see you guys the next time.
Yes, thank you, everyone. Thank you so much, Joe.
Annika, does Maryland Food Bank do the same type of report?
I'm not sure. We need to, I wish that Meg was able to stay on for the full meeting, but I know that they do annual assessments, but I'm not sure how they publish it.
Okay.
That would be helpful to look into. I can look into that and send it out with
Okay. Thank you so much for all you do.
Thank you,
Appreciate
Diana.
And Diana, we are going to have a small report on Food as Medicine, a local program that we have on our food conference. Our food conference, because of the